All right, beautiful. Welcome back to Friday surgical series with the Midwest Implant Institute. We're going to be doing an immediate extraction here on tooth number 29. We've got a tooth that has had a prior endo, post and corner crown that has fractured off. So we're going to sit and kind of manipulate the soft tissue here just a little bit, see whether or not we can do anything with just, and see if we can't pull this piece out of here in a couple of different pieces. So, we can basically go right down where the root canal is, and we just kind of move things medial distally here to barely break through the tooth, and go down as far as we can. That's why we use the extra long tip. You need to go down as far. So this is really just kind of where we're patient here, because eventually, we need to. The main thing we need to do here is maintain our buccal plate. And as you know, what's lurking apically here is we've been able to move that piece of tooth structure right away from the buccal plate and take that stress off of there. And that is a huge, huge part of this whole process here. Sometimes it's that easy and sometimes it's not. So before I get off, and let me have the needle nose, please. Take this. Thank you. So, obviously there's only so much space in here. I'm hoping like heck that this includes the root. If it does, that'll be a huge plus for us. It's hard to grab a hold of this. Because we've got nothing but decay that we're dealing with here. Alright, let me have that straight periotome now, please. Alright, see if we can't. I got a little more space. And good news is we've also taken out a little piece of that lingual. That came out. That's awfully nice. Beautiful. That's for the betterment of taking the tooth out. Alright. Let's see here. Let me see that needle nose again. Now that we've created that space on the lingual, maybe I can get down a little bit further to then be able to rotate this rest of this root out. I feel like there's a little ball on the end of this. You can see I've got my hands on her top teeth helping protect that. So that means Some point in time, you just cry uncle. Come anterior, Karen. Thank you. You're doing great, my dear. This little piece of tooth structure is just, it's fatter at the tip than it is in the middle, so it's not allowing us to take this out. So, maybe just take out a piece of this. Yep, gotta protect those teeth up top. Alright. Anything on there? Can't tell. Okay. Boom, boom. Well, just can't get enough force on it. Alright, kind of get that little piece out. Go, Karen. We're good right here. Oh, something came out there. Mm-hmm. Boom. Alrighty then. Awesome, Dawson. Durette. So, now we got that fun-loving little tooth out. So, one of the things that's going to come out, that right down here is where that mental nerve is. So we got to make sure we're maintaining distal contact. Alright, beautiful. Okay, so got almost. So, we got to turn your head to your left just a little there for me. That better? Okay, beautiful. So we obviously want to stay away from the buccal plate. So we just need to just barely get this started apically. I gotta go down inside, honey. I've got to recontour that distal bone and see what happens. Okay. All right, good deal. Coming anterior, please, Karen. Thank you. Just relax a second there again. You're doing great. We just don't, the preparation process is really, really minimal because we can't really go very deep because that nerve's right down here. So I'm just trying to, you feel anything at all, you just got to let me know, okay?
Alrighty, I will.
All right, good deal. Okay. Yeah. Okay. And just turn your head to your left a little. Thank you so much. All right. Yep, Karen. Just leave it off of the extension and see if I can do it without it. Mm-hmm. Okay. Good job. Yeah. Go, Karen. Yeah.
Three.
I know. I'm trying to. That's the problem with our. Yeah.
3.8.
Okay. Mm.
4.3. 4.8.
Take that off. I'm going to put it in here. All right. I'm going to take a quick x-ray here now, okay? You're doing great. This is the 4.8, Karen.
Yes, that's correct.
I still don't have the stability. Hold on a second. No. Maybe I do. Yeah, let's take a quick x-ray. There's a little piece in there. Don't bite down hard, okay? All right, now just close real easy on my thumb. Right there, good job.
Sorry, I'm leaning on your shoulder. Try that, Jade.
Good deal. Okay. Make sure. Good. So, mhm.
Relax.
As we're just waiting for, we're just kind of changing implant kits here. We've got our introductory course that's going to be coming up here August 22nd, 23rd, and 24th. And then, what are the exact dates for our symposium? Okay, and then October 18th and 19th, we're going to have our 34th annual symposium. So we've got two big events coming up in the next few months, and so I'd like to have you join us if you possibly can do it. We only have one seat left for our August course, and we're got 30 or 40 seats left for our symposium. So just let us know. Just give Destin a call or send him an email, and he'll be happy to get you signed up. All right, good deal. Okie dokie. Right in between that. Okay. On a tooth.
Yeah, it's the water.
Better.
Yeah.
Okay. Let me have, is that the 11 and a half?
11 and a half and 13.
Okay. Still doing all right? Good. Yep. I just don't have what I need. Put the liniment back on there, please. Just not.
Do you want that on the extension or no?
Well, if you got that extension, yes. Thank you. All right. Okay. Give me the 3.5, 11 and a half. See if I can get that in there.
3, 5, 11 and a half.
Thank you. Mm-hmm. Yep.
3, 8, 11 and a half.
Thank you. Okay. Let me have that blank back, please. I need to take an x-ray again. And close just a little bit. There you go. Perfect. Thanks.
Okay.
Is that it?
Mm-hmm.
Okay. Alright, I just can't. Okie dokie. It's hard to tell whether or not I'm getting something that will. So let's put in a 5.5 11.5 to see if I can get any kind of stability there. I can't go to 6.5. It's too wide for the tooth we're replacing. All right. Yeah, the shape of the root kind of really dictates, and that being a little bit wider apically makes it a little more of a challenge, because I can't really engage any more bone apically because of the mental nerve there. So that's, we go in here and we don't get the torque value, we're going to change things up here, and we probably will just graft and come back later, 3-4 months later, because you put something in there that doesn't have any torque value, we don't have the ability then for our osseointegration to take effect. So we've got to have a certain amount of torque value to stabilize the implant. So that's what we're up against right now.
Okay. 5, 11.5.
Okay. Mm-hmm. And the nice thing about the design of this implant is that's a good sound, okay? Hearing that little click, that gave us the ability to know that we've got over 35 Newton centimeters. So that's a good thing. All right, wonderful. Really what we were kind of expecting, but you just never know when you do it. All right, I'm going to take this off and just verify where we are occlusogingivally. Mirror, please. Just like lunch, lady. Hmm. Yeah, I think I'm gonna stick with that right there. Cool. So we got one of our slots right out to the buckle, and now we're going to put our cover screw on, and we'll go ahead and graft in our defect, and then we'll put a little 3mm healing abutment through a PRF plug, and then that probably will be it. That worked out very, very nicely. Yep, worked out very, very nicely. And, all the while you're communicating, just to make sure she's not feeling anything, just because of where that mental nerve is apically.
I was trying to scoot.
Okay.
Do you want the other 9, Karen?
This may be it.
There you go.
There's that. I need a blot, please. Okay. Let me have a curette, please. Go, Karen. This should do it. Just beautiful. Absolutely beautiful. Okay. Now go ahead and take our cover screw off. And we're getting a healing abutment so we can push it right through our PRF plug. All right. All right, so you have the Woodson 1, please. All right, Karen.
Do I have it? You might.
So got a really big PRF plug here. Just try to, kind of like you're working with a cord. Slowly but surely kind of just tuck it right in there. Just keep working with it. Mm-hmm. And that really kind of probably just seals everything off. Go. You know what? We're just going to go ahead and put some pressure on that. And I don't think we're going to need to put any stitches in because we got all of our PRF plug is just sealing everything up so nicely. So we'll go ahead and put that pressure on there, and then we'll get a post-op x-ray with the implant in place. And then we will go ahead and we'll have her bite on a platelet poor plasma and our Stella Life gel. That'll work out beautifully for us. So we just got to let her heal. So nice little thoughtful, methodical surgery here. All right, excellent. I just close real easy again. There you go. Good. Thank you so much. Pull back. Okay.
Okay, Jade.
There you go. Good deal. Awesome. Good job, my dear. You did wonderfully.
All right, good job to you.
Thank
too.
you. Thank you. Yeah, so that's a nice thing. Get a tooth out. Doesn't feel a thing. No no block, just infiltration anesthesia, and that's what we need to do, especially around the nerves. So if you're doing blocks around nerves, you got to be ultra cautious. But I would tell you, please don't do that. Just use infiltration anesthesia. You can take teeth out that have nerves in them. Just do a infiltration anesthesia right down the root. think that will work out to your benefit. And if you need to section things, you can do that as well. So this is a really, really good, nice result here for us to do a immediate implant placement after extraction. So thanks again for joining us here at the Midwest Implant Institute. We'll look forward to seeing you very near future. And again, we've got our 411 coming up at the end of August and our symposium at the end of October. So we look forward to seeing you at both those fun events. Thanks again and have a great weekend. And oh, by the way, happy birthday to my dad of 87 years.